Bonsoir à tous, bonsoir à toutes, et merci de
Good
prendre
afternoon to all of you, and thank you for
l'expérience autour du
being here for this webinar on experience sharing related to the equitable partnership with financial support from the Hewlett Foundation since over 18 months. And this is targeted at 3 African Francophone countries. And we are starting with 5 minutes delays. And as I said, we have started this partnership for 18 months now in 3 countries in Africa, including Burkina Faso, Benin, and Côte d'Ivoire. And I am Ilmi and happy to facilitate this meeting with the support of Geraldine. Over to you. I'm Geraldine, I'm project manager. You can hear the person. I'm a member of the consortium as part of the Equitable Partnership Project, and we have participants connected from all over in Africa, Asia, and Africa. So feel free to select the language that you deem most suitable for your intervention at the bottom of your screen. And when you are on the floor, feel free to specify your name, title, and organization. If you do have any question, kindly put it via the chat. And Geraldine is also here with me, and this is the topic of our meeting, which is based on sexual and reproductive health. In the first part of this meeting will be marked by the project presentation and followed by a discussion panel with representatives of youngsters from the 3 countries who have benefited from this equitable partnership with EngenderHealth. Without any further ado, we are going to receive the intervention of Mohamed Lee, Regional Director of EngenderHealth, for his welcome address. Thank you to you. Thank you, dear moderator. Good morning, good afternoon, wherever you are. I'm going to be very brief in my intervention. Firstly, I want to thank all the participants and panelists for your time to participate in this meeting, and my acknowledgement to the Hewlett Foundation, which made it possible for us to establish this equitable partnership with youngsters from 3 African countries. And we thank Janet for their constant support in advancing the sexual health agenda in the region. And we also thank all the team for making this partnership possible. We thank our colleagues from the headquarters and across the globe. I thank all the participants, and I'm going to stop here to say big thanks to our partners for making this possible. And I wish you fruitful deliberations. Thank you, dear Mohamed Lee, Regional Director of EngenderHealth, for this welcome address. And I hope that you are all well set to take part in the discussions under this model of partnership. So for the opening remarks, we are going to turn the floor to Mrs. Janet, who is in charge of the equity program at Hewlett Foundation. Mrs. Janet, good afternoon.
I'm going to speak in English because it's very early in California, in the USA, where I'm based, and my French is much better once I've been awake longer. It is a great pleasure to be with you all today. Thank you very much to the EngenderHealth team and to the YLOs that are with us today for inviting me to say a few words. So my name is Janet Holt, and I'm a program officer at the William and Flora Hewlett Foundation, where I co-lead our global reproductive equity funding strategy. We make grants that support our overall funding strategy goal that women and girls in East Africa and in Francophone West Africa, especially those facing the greatest barriers, are increasingly able to seek access and use comprehensive reproductive health care, inclusive of abortion care, to further their health, well-being, and life aspirations. That's our goal. We've been honored to support the work of EngenderHealth in this region for many years now, beginning with projects primarily in Côte d'Ivoire. When it came time to discuss this phase of funding with the team, they put forward this ambitious idea to work more closely with youth-led organizations on SRHR, but also on better partnership principles around equity, around empowerment and strengthening of organizations. We were pleased to be able to support their vision and have recently renewed another round of funding for the continued work of this project through 2025. We have been really impressed to hear from the youth-led organization partners under this program that they've enjoyed more open and trusting relationships with the EngenderHealth team, and that they've benefited from being able to focus not only on their SRHR advocacy skills and their organizational goals, but also on the strength of their organizations through this funding. This is a principle that we value very much at the Hewlett Foundation as well, where the majority of our funding is flexible and trust-based. We pay particular attention to the dynamics of power when our grantees re-grant funds to smaller organizations. And this project has lifted up many strong principles that we've learned are best practices in how to effectively re-grant to organizations that strengthen those organizations and promote strong trust-based and transparent relationships. I'm very much looking forward to hearing from EngenderHealth and the youth-led organization partners today on what they've learned the last few years and sharing that with you all. And looking forward to hearing about what's next. I hope we can all walk away from the discussion today feeling as inspired as I do when I hear from these people about the strength of young people in this region and how hard they're working to improve the sexual and reproductive health and rights of their countries. Thank you very much.
Merci, Madame Janet Hodge.
Thank you, Mrs. Janet, for your opening address. And thank you for the support of the Hewlett Foundation to this process, and also for your word of hope. And this is well heard by the youth. And we are sure that during the discussion panel, you will have the experience sharing session on this specific matter. I just want to mention that she's in charge of the Gender Equity Program, Gender Equity and Governance Program at Hewlett Foundation. Now they are seeing a set, and we are now going to delve into the various presentations. This is now the time for Mr. Matt Fuchs to take the floor. He's a country program manager in Benin. And over to you, Mr. Matt Fuchs. Thanks a lot, Amin and Geraldine. I hope you can all clearly hear me. Thank you for the opportunity to present the Equitable Partnership Program with the local organizations led by women and youth in West Africa, mainly in 3 countries, including Benin, Côte d'Ivoire, and Burkina Faso. The purpose of this project is to rethink the partnership with the local organizations, review how organizations such as ours are collaborating with the local youth-led organizations, and review the partnership to make for them to feel valued, and also review this partnership in the perspective to help them to be at the central stage of this program. And our approach is based on equitable partnership. And when it comes to equitable partnership, just want to take you back to the context of this partnership. On one side, you have organizations such as EngenderHealth, which has about 70 years of experience, and it wants to form a partnership with organizations with only 2 or 3 years of experience. So you can see that from outset, we are not on the same footing, because EH has a great deal of experience and it comes with a lot of perspective and power. So it was important to become aware of this power from the start of the partnership and find means to strengthen such partnerships so that any organization joining the partnership may feel valued and also understand that their voice is relevant under such partnerships. So what have you addressed so far as problems under this partnership. Three key issues were addressed. First is to increase youth participation. We want them to be central to the sexual and reproductive health processes, as well as the decision-making initiatives. So this was the first problem that we have tackled. The second issue has to do with the low collaboration between these organizations acting as activists or using activism as a drive. And we wanted to increase the collaboration with the SRHR services. So we want to promote gender equality and also support them in the fight against gender-based violence. And we also have service providers who are also looking into the same matter. They are all addressing the same topic, but they are working in silo. So we wanted to get in touch with them and bring them together, because this is an action that should be done together. We shouldn't be working single-handedly. The other aspect that we have tackled was to use the feminist approach, that is to promote a female-based approach so that the environment can be conducive to our interventions in the respective countries. And you are aware that this is a matter that we have been working so far to make it more appropriate and conducive for the interventions related to sexual and reproductive health and rights. And we have been working in these 3 countries, and 9 organizations were shortlisted. Why 9? Because we wanted this idea cut across the whole system down to the bottom, so that they can also become part of this partnership. So for most of them, it was the first experience to work in partnership with the youth-led organizations. And we are aware that these are not matters that we can address second-handedly. It takes synergy, and synergy is to be strengthened right from day one. And there's this saying that is in the country, saying that alone you can go faster, but together you can reach farther. So this is how we have been able to bring together these organizations to work together, and there are 9 in total. And all of this was made possible as under a very simple partnership made up of 6 key steps. Not going to delve into the details, but we generally begin with a sort of debate on the requirements of the organization. What are the financial, administrative, and thematic needs, and where there's need for capacity building? What is it that is necessary for them to act as a strong organization? And then from that, we develop a capstone-based training program that will be addressing their identified needs. And on top of that, we provide a workshop for the development of the action plan. Then comes the financial support to allow the organization to feel comfortable and as a leading institution. And the principle that inform these partnership is centered on 3 points. First is the need for us to make sure that youth-led organizations are part of the designing of the program. It's not something that is cut in stone, something you cannot change. No, because the youth-led organization can come tomorrow and say that in the light of the context, this activity that was planned has to be changed. So the programmatic approach is the key principle that we have used. And the second principle is youth-centered approach. So across all the steps in terms of decision-making and designing phase, we wanted the youth to be empowered to make the appropriate decision. And the third principle is a apprenticeship, because it's a new partnership for us as well. We did not have this experience before. So we have set up a mechanism for apprenticeship, which helped us to listen and also to document all the lessons learned as part of this process. And this is what we are sharing now with you as part of this webinar. So to wrap up, what I can say that is, in terms of lesson learned, a lot were recorded, but maybe I will share 3 of those with you. The first one is that the local organizations led by the youth and women have enormous potential in terms of impact. But to make this, for them to make sure that it benefits the SRHR activities, there's a need for an inclusive partnership, not centered on activities alone, but a partnership that addresses their financial and administrative needs. Because sometimes we have to come out of our bureaus and allow them to come in and use our premises and internet connectivity as well. And the second thing that we have picked up from this partnership has to do with the content of the support. The support for these organizations cannot be something that is unique or simple. It has to be a custom-made and flexible as well. It's something that addresses their specific needs, because youth-led organizations, they look alike, but they are not having the same specificity. So we thought this was important to address their needs as part of this supportive initiative. And the last point is that if we set up a partnership process with local organizations as led by youth and women, it has to address also the cost, like if they need of printers, rent, or offices. When all of these needs are addressed, it strengthens the trust and improves on the partnership. So I'm going to pause here and also take on your potential questions with a great pleasure. Thanks a lot. Thank you, Matthew, for your presentation, which is quite comprehensive, and also help us to understand that to understand the ins and outs of this model of partnership, which addressed the well-being and needs of the youth and women-led organizations, to make for them to work together as a consortium, and also to benefit from the capacity building support and make the activities easier. So this is a flexible partnership giving priority to apprenticeship, and also it is centered on the youth needs and requirements. At this stage, we are going to get down to bedrock, giving the floor to council reps to share a few with us on their experience related to this partnership. So the first speaker is from Burkina Faso. She's an activist with 3 years experience in the health and sexual reproductive rights. And this is Yamego Stevie. Good afternoon. Good afternoon, Edmund, and thanks to each and every one of you for making it possible for us to be on this call. It's a great pleasure. Thank you. Thank you, Stevie. And next is the Women and Resilience Consortium, represented here by Salimata Balde. She's the Executive Director of the Actuelles in Côte d'Ivoire. Good afternoon, and thanks for being here with us. Good morning, Amy, and good morning to all of you. I deem it a great pleasure to be here with you this afternoon for this webinar. I thank you for the invite, and I hope we are going to have a fruitful deliberations. Thank you, Balde. And to finish, we have Margaret Mucho from Benin. She's an expert in SRHR, and she's from ROAJELF, and representing here the consortium, as well as the Famille Nutrition et Développement NGO. Good afternoon, Elmine and Geraldine. And good afternoon to the entire team. We are losing the speaker. She's breaking. Thank you, Mariette, for having us here to share our experience. Mariette, I think we are having some connectivity issues. Can you hear me? We hope the internet connection will be much better during the discussion sessions. So the first question is for you, Marielle. We have already discussed the equitable partnership with EngenderHealth right from the start of this process. So I want to know, what do you think, what is it that has made this partnership beneficial for the organizations in Benin, and specifically for organizations such as and the youth organizations?
So, thank you very much, Geraldine. We cannot hear you anymore, Mariette. Could you please move a little bit? In the meantime, let me turn to Cindy. We know that Burkina Faso, sorry, Mariette is still in the background. Mariette, we cannot hear you clearly, so let's move on and come back to you later. Yeah, go ahead, Mariette. So I was saying that what has been really beneficial for the partnership, in the partnership, is that EngenderHealth is one of those organizations that have a vision of supporting youth organizations like ours. First of all, I would like to talk about organizational strengthening. Not only to implement interventions, but also in terms of organizational, administrative, financial, and programmatic development. In this respect, we've received a lot of technical assistance trainings in financial and administrative management, and also at the programmatic level. I would also mention that this partnership has enabled us to build the capacities of our organization to manage its operations in a very effective and efficient manner to strengthen the sustainability of the organization and achieve good results in projects. There is one thing that is really dear to us, which is to appreciate the fact that EngenderHealth has supported us in terms of our fixed costs. This is a really key element in this partnership, because thanks to this support, we did not have to worry during the project about where to find funding for our fixed costs. And we had time to focus on the activities which has generated good results. In terms of equitable partnership, note that the project we implemented in Benin was not brought by EngenderHealth, but it was jointly created by the members of the consortium. And by the members of the consortium, you already know which are those members, ROAJELF, Benin, and other organizations. We designed this project by taking into account the challenges we are facing, as well as the goals we want to reach and the context. And all this was part of our strategic vision, or the strategic vision of our three organizations. Still going on, I would say that this partnership has really been placed youth's actions at the center of everything. Youth taking part in project management and administrative management, how to set up a project, how to do monitoring and evaluation, and also how to ensure accountability. Also, resource mobilization has been a very important element, not only during the project, but also we're still receiving calls for projects and applications, calls for applications from EngenderHealth to generate more resources and also bring in additional partners. So that's what I can say regarding this partnership with EngenderHealth. Thank you. Thank you, Mariette, for describing these things that make the equitable partnership beneficial for your consortium in Benin. You raised many things, namely the meaningful participation of youths, institutional support, also resource mobilization. So let us proceed with Stevie from Burkina Faso. Stevie, in the context of Burkina Faso, what key actions what have you mainly drawn from this partnership, and what were you able to achieve in Burkina Faso through this partnership? Thank you very much for this question. Since 2015, Burkina Faso is affected by a security crisis which is exacerbating gender-based violence, where women are facing a kind of vulnerability where they cannot exercise their rights and their freedom. So in this context, we found it useful to address this issue of low respect for women's rights and gender-based violence in Burkina Faso. And we proceeded through social mobilization to promote women's rights in order to reduce gender-based violence in the country. On the operational plan, we followed an approach that is focused on the survivors of GBVs. We're not calling them victims because we want to give some hope to those people affected by gender-based violence, for them to have the possibility to rebuild their life and to survive those violences. So we wanted to work according to an approach focused on the survivors, but also on the youths. Because in addition to gender-based violence, we also integrated the promotion of sexual and reproductive health and rights. So we co-created an action plan following this approach focused on the survivors and youths. The needs of the youths and the survivors were collected and documented. And through the collection of this data, we also tried to see how to create effective tools for awareness raising in order to shed light on the magnitude of GBVs in this context marked by a security crisis, and especially following the COVID-19 crisis that have further exacerbated the violence. So we prepared some awareness-raising video clips containing testimonies of survivors, and we still, in doing that, we maintained confidentiality. So still in terms of actions, we collected and documented the needs and the experiences of survivors. And we also conducted a training of the youths on SRHR and GBVs, and also on the identification of the specific needs of those youths and survivors. So we prepared the video clips, and from the video clips, we also put in place some social mobilization and policy actions to organize intergenerational dialogues, where we brought youths and adults together, all stakeholders together, to discuss the issues of gender-based violence, but also to define new strategies and to overcome and address these issues. In Burkina Faso, in our area, our focus area, we put in place some activities in rural areas in the Konki, Ipala, in 3 areas, Konki, Ipala, and Consilga, and Kurbi. Okay, thank you very much. No, to finish, just a last point to finish, I would like to say that these actions have enabled us to really also conduct local and community-based advocacy. So through this, some commitments were made by the communities, and we are expecting the continuation of the project to ensure sustainability by monitoring and following up on those commitments. Thank you very much for sharing this experience from Burkina Faso. And so the youth organizations in the case of Burkina Faso have conducted activities that are focused on the life experiences of survivors and the needs of youth in order to raise awareness at the social and political level. Now, let me turn to Salimatu, ask her what actions or achievements make the Côte d'Ivoire Consortium proud regarding the implementation of this project and the plan of action for equitable partnership. So, since those youth organizations have benefited from this partnership. So, Salimatu, anything to share with us? Yes, thank you, Geraldine. Thank you, Hermine. In Côte d'Ivoire, you might be surprised, but we did not have only one achievement, not only one success. We had a whole range of targets and goals that we were able to reach. And each action we undertook make us really proud. Proud because this came up following a process. We had to engage into a process to achieve these results. To start with, we first had our skills were built. That's number one. So that was an action of human capital investment. And also our leadership has been improved as a young feminist organization working on issues including GBVs. Another thing is also the facilitation of our decision-making systems, strengthening of our commitment. And in addition to that, we also benefited from the support given to certain actions we undertook regarding, for example, the law to protect people victims of domestic violence and other types of violence. We participated in the amendment of the laws, and the law was finally promulgated. And we were really happy to have this law in place because it was something very important for us. We needed to have a law that protects the victims of violence in Côte d'Ivoire. In addition to that, we also had some benefits on the side of our beneficiaries. Through the support given to us by EngenderHealth, we were able to achieve inclusion because in carrying out our activities, we placed inclusion at the center of our plan of action. So we were able to build the capacities of the beneficiaries and also to collect their opinions. We were able to take up this challenge. Another challenge we took up and for which we are very proud is that currently there is a workshop going on, a workshop to develop and validate and to proofread the law on reproductive health in Côte d'Ivoire. This is something we are very proud of because since 2004, we've been talking about this law in Côte d'Ivoire, yet there is it was still not in place. And today we are talking about a revision of that draft bill. So these are those achievements we are really proud of. And especially the working together with EngenderHealth has been a great pleasure. Thank you very much for sharing this with us. And congratulations to the consortium of Côte d'Ivoire and to all the other consortia for these achievements as presented. Now, I want to revert back to Stevie. Stevie, during the implementation of this partnership, when you joined your country's consortium, we know that when youth organizations come together, when youths come together, we generally tend to say that when it is not easy for youths to live together, to work together. So as a youth led organization, what were your concerns at the time of coming together with the others? Thank you, Hermine. Before joining this consortium, we were really concerned and we were wondering how we would be able to take up this challenge. Not only first, how would we be able to achieve this consortium, to set up this consortium and to effectively work on issues relating to sexual and reproductive health and rights and gender. So this was a first experience, setting up a consortium. And it was also the very first time we were preparing an action plan on these topics. So we were already concerned about how to do the communication and also about our technical capabilities to make this consortium effective. But through the contribution of all the members and all the stakeholders, we were able to address and to take up this challenge. Because as I said, our main concern was how would we make this consortium successful? But through this equitable partnership, we received support from EngenderHealth and also from other organizations. One thing important to note is that during this action, we also collaborated with the Ministry of Gender through its directorate in charge of victims and gender-based violence victims. So these were the concerns we were having at the beginning. In addition to that, we were also concerned about the accountability process. Given that this was our first experience, we did not have the tools in place to do monitoring and evaluation and also to do project results capitalization. But we were able to overcome this challenge in the partnership through the support of our partners. Thank you, Stevie. Now let us hear Salimatu. Salimatu, in Côte d'Ivoire, what have been your challenges and your concerns before starting the implementation of your plan of action? Just like every human activity, we always face challenges in any activity. And one first challenge we faced was how we, as a small organization that is not well experienced, how would we be able to work on such a big project as the equitable partnership with such a big global organization like EngenderHealth? So the first concern was, would we be able to live up to the expectations? And that was something that was really concerning us. And we discussed about this a lot to see whether we were up to the task and we would be able to deserve the trust placed in us. Would we be able to reach our goals? Also working with new colleagues that we had never worked with before, how would we manage the aspect of leadership? Because, you know, we tend to say that when women organizations or youth organizations come together to work, it's not easy because each of them wants to take the lead. So we needed to find a good balance to avoid harming anyone. So we were asking ourselves these questions, and gradually, as we started working, first starting with the training sessions, meetings, discussions, and co-design actions, we saw that it came naturally. It was something that was like innate in each of us. We just needed to see how to exploit this potential and move on. So at the beginning, we were having the concerns I mentioned earlier, but once we started, we really found that all the people involved in the organization, the partner organizations, were really engaged and were supportive. And they assisted us whenever we had concerns and when we got blocked and we couldn't move on. That we have always had the opportunity to turn to somebody and share our concerns with them and get their guidance. And this has really worked every time we had to do that. Thank you very much. Because of time, let us proceed. I want to ask Mariette, do you have anything to add concerning your issues at the beginning of the project? Yes, of course, when it comes to a consortium, even though a consortium has some benefits, but before you engage into that, you will always ask yourself many questions because you are not familiar with the people you're going to work with, and you don't know how the partnership is going to move on. But given that we were facing the same challenges, we naturally had to work together because we are following a same objective and we had the same challenges to overcome. So we all work to make it things be successful. And also working together helps to build our relationships and to address any issues that come up. Thank you. Thank you very much, Mariette, for sharing this experience. Now, let's still stay with Mariette in Benin. Tell me, what actions do you think you should engage in to, what would you do differently from what you did to get more partnerships with international organizations? First, in the case of Benin, we did a documentation of results for the purpose of capitalization. And we think that we want to really build on this equitable partnership and turn towards the other partners we are working with and who are not doing equitable partnership. We would like to enlighten them about the benefits involved in equitable partnership so they also can engage into that. So the idea is to document this experience that has been gathered and to share it with the partners we are working with, not only to disseminate this experience through the meetings we will be calling for, but also to be able to disseminate it through our different platforms, social media, and so on. This, I'm sure, will make it possible, will be helpful to the partners we are working with, and for any potential partners to really learn from this experience to improve their experience with other youth-led organizations. Thank you very much, Mariette. Stevie, now to you, what do you think could be done to improve this type of partnership based on your experience and the challenges you faced? How can things be improved? In terms of improvements in this partnership, the first thing I would say is to first analyze the strengths and weaknesses of each organization before setting up the coalition, because for this experience, we did that exercise, but what should be done is to conduct a really detailed and thorough analysis of the strengths and weaknesses so that we can fill the gaps quickly through joint solutions and measures. Another proposal is to conduct a field analysis or before setting up the plan of action. I'm saying this because in the case of Burkina Faso, even though we did a gender-specific field analysis on GBVs and sexual and reproductive health and rights in our target area, but we did not do an in-depth analysis. So that's my suggestion, because when preparing the budget, we found that there were certain elements that we did not include. And at the time of implementation, we faced some minor challenges because of those omissions. But this must serve as a lesson to improve the partnership. And another thing I can add has to do with the actual engagement and involvement of youth-led organizations, because and also to introduce a system of a 6-month put in place a system where we can have everybody when we need, because in our experience, it was at a certain time difficult to mobilize everybody, given that the agendas were really tight, considering that those organizations had their own internal plans of action to implement. So what should be encouraged is to involve all stakeholders from the beginning. Government, institutions, traditional leaders, and other stakeholders must be involved from the beginning. Okay, yeah, thank you very much. Because time is running, let me turn to Salimatu if she has something to add in terms of improving the partnership. I think Stevie has raised a lot of things that I would not repeat again. So let us stick to that and take any questions. The only thing I would add is to tell the other partners hearing me now that those partners who are participating in this webinar, I'll tell you that this is the time for you to engage into equitable partnership. Thank you very much to all of the panelists. So you talked about analyzing the strengths and weaknesses of the organizations and conducting a field assessment before setting up this plan of action. So dear participants, please continue to write your questions and concerns in the chat box. We already have a few questions, so let's go straight and take those questions. The first question says, this partnership and support, did it enable you to get other financial partners? And if so, how do you link this partnership to the support given by your other partners? So the first question is, did this partnership enable you to have the other financial partners? Yes, in Côte d'Ivoire.
Nous avons pu mobiliser l'ambassade de France. Nous avons pu mobiliser d'autres partenaires. On a eu à travailler avec Equipop.
Yes, we work with other partners, Equipop, IPAS, and we also worked with the Embassy of Canada. These are partners that we brought in around our projects and around our plan of action to be able to implement it. And also, we shouldn't forget that after this project, when we completed this project, we also applied for UAF, and UAF is supporting us with a 6-month funding. So to answer your question, we were able to bring in other partners. And actually, what should be done, as I said, is to invite them to learn from the experience we had with EngenderHealth and with the Hewlett organization. Don't you think if you do the same, we can reach a certain goals? So that's in short what I can say. Thank you, Stevie. Now, is it the same thing in Burkina Faso? And yes, same in Burkina Faso. And I said it earlier that we have really collaborated with the Ministry of Gender through the directorate that takes care of women victims of gender-based violence. And also through this partnership, we were able to strongly contribute to the preparation of the youth strategic plan for the period from 2022 to 2023. And we were also able to receive support from Urgent Action Fund, UAF, to cover gynecological and obstetrical violence. And we also did not forget other youth organizations that have contributed to a good deployment. For example, the ABBF and the IBBF also has contributed their expertise in the area of gender. So these are the kind of achievements we were able to have through this project, and it is worth continuing. Thank you very much, Stevie. Another question is, how have the experiences documented? apart from the video clips. And I think this question is for you, Stevie. How do you document these results, this experience, apart from video clips? Those video clips were used to collect testimonies, but we also conducted the data collection exercise through a consultant who went on ground to interview the target populations. And also, one thing we do in our consortium is to do action research on the topic. So this is something that we started with in this partnership, and we are intending to continue that in future activities and initiatives. We cannot hear well. And then there is another question on how did you document your achievements, project achievements or results? I'm not sure whether I heard you well, but as regards how we documented our project experience, we integrated that from the beginning of the project. And we relied on change-oriented approaches, where we first identified the changes we wanted to achieve through the project. And we prepared a video showing interviews with the project target populations and also some members of the consortium in order to get a general assessment of the project actions. And we did it not only on paper, but through videos in order to really capture all the experience we've had in the project. Thank you, Mariette. There is another question. How have the consortiums in each country, have you involved grassroots organizations into the implementation of the project? How did you mobilize other youth-led organizations in this project or around this project? First, we started with the co-generation or co-creation of the project. We received a lot of feedback and information from those organizations that were already on the field in order to design our project document. And when the project was finalized in Benin, we organized a meeting, an out-brief meeting with all other organizations to find out whether the project has taken into account what they have, the information they shared with us at the beginning. And now, in terms of project implementation itself, every time we involved grassroots organizations, community leaders, and youths, so that this project will not be a project of our organizations only, but a project that is a community project. Thank you, Mariette. That's the end for the questions session. Yeah, there is a last question. What challenges have you encountered, specifically main challenges encountered during the implementation of this project? So let's say one challenge from each consortium. Please, Stevie, can you tell us what was the main challenge? In Burkina Faso, can you hear me? Yeah, I would say in Burkina Faso, the main problem or main challenge we faced was about the budget aspect, because as I said earlier, I said there is a need for harmonizing the budget because we did not include everything in the project. So as a result of this, there were some unexpected events that we had to manage. So we had to take measures to address unplanned events or unplanned issues. As for Benin, we had an issue of communication and also because at the beginning, our organizations were not prepared to successfully document the achievements through videos and other things. This is actually one of the lessons we have learned, and it's also something we need to improve on in the future of the partnership. Thank you very much. We cannot hear her well. What are the main types of violence found in your region? And then, are you intending to have a project or a project in Nigeria? I think this question is to Maifus. So are you planning a project in Nigeria? Or do you have or intend to have a program or project in Nigeria? Yes, we have, EngenderHealth has a presence in Nigeria. Now, is this current program covering Nigeria? The answer is no, it doesn't cover Nigeria, but we have a presence in Nigeria with other interventions. So the last question was about the main types of violence that you encountered in your countries, Benin, Burkina Faso, and Côte d'Ivoire. Let us finish the discussions with this last question. In Burkina Faso, the types of violence we encountered are mainly gender-based violence and sexual violence, especially given the security context. We are encountering a lot of cases of rape, sexual harassment, sexual assault, and most of the survivors who testified mentioned those types of violence, even though we also have other types of physical, psychological, and economic violence. And for Côte d'Ivoire, what I could add, in addition to sexual and gender-based violence, we also had cases of rape. Rape has been really high, and also we had household violence, and also we have harassment in schools. Recently, there was a study that was published by a feminist organization based in Côte d'Ivoire, and which mentioned a high percentage of harassment in one of the major universities in Côte d'Ivoire. So this is something that is widely encountered not only in Abidjan, but in also other parts of the country. There is so there was a question on the concerning the question to EngenderHealth. Malamita says we have a presence in Niger through the project. Sorry, I want to beg your indulgence for us to take a few questions. A participant is asking, how did you bring the youth to show interest for the project? How did you get their interest for the project? Mariette, Benin, mainly in Benin, we first worked with male youths on positive masculinity. And curiously, we were surprised to see that they were really open and they were willing. We didn't have to use any particular strategies because we found that the youths needed to address this issue and to discuss this issue. And we also used the social media to reach out to more youths. So the point is to be able to bring together the youth around issues that interest us, and sexual health and reproductive health is something that interests the youth, indeed. Thank you very much, Mariette. We are going to now finish this question and answer session. But before we finish, do you have any final words? And what guidance could you give to other organizations who would like to engage into this equitable partnership? First, I would like to say thank you to EngenderHealth for bringing this partnership. As I said, this partnership has enabled our organizations in Benin to have some relief in terms of fixed costs and also in terms of administrative and programmatic development. So if I have one word to say is to ask the partners that before requiring results from the organizations, please consider that those organizations have some costs to cover. They have some specific needs in terms of organizational development that you need to take into account if you want them to achieve the expected results. So in short, I would like to invite the organizations and the partners to follow in the steps of EngenderHealth and enable our types of organization to make more impacts. Thank you, Mariette. I think Mariette has said almost everything. We would like all other organizations to learn from this equitable partnership, which is a first experience for us, so that youth-led organizations and female organizations can be more self-sustaining in order to reach their goals. Thank you very much. Thank you, Balde. I would also express some thanks to EngenderHealth for enabling us as a very small organization to have this experience and to get stronger. And as for other organizations, I encourage them not to hesitate at all to jump on the ground and harness this type of opportunities and to be ready to receive and to give. Thank you very much, dear panelists, for these insightful presentations and discussions. Thank you to everybody, to all the participants for joining this discussion around the equitable partnership action of EngenderHealth through the support of Hewlett. And this is something that strengthened the meaningful participation of youth, not only in terms of activities, but also the sustainability of their organizations on the administrative, financial, programmatic, and institutional plans. The plans of action that were developed through co-creation are something very successful and encourageable. And also those organizations have received the support in terms of mobilizing to be able to mobilize further resources. So thank you very much for attending. We wish you a good end of day.